AHCA inspectors have the authority to enforce the Federal Code of Federal Regulations, or CFR, and the state's regulations pertaining to healthcare facilities. It is important to understand that while they cannot override existing codes with their own personal standards, they do possess the ability to interpret those codes and to issue citations based on the specific interpretation of the regulations. A practical example of this involves the CFR requirement that nursing homes must provide a safe and sanitary environment for residents. AHCA inspectors interpret this requirement to mean a variety of things. Firstly, nursing homes must maintain clean facilities. Secondly, these facilities must be free of hazards that could endanger residents. Thirdly, staff members are required to be adequately trained in infection control protocols to prevent the spread of illness. If an AHCA inspector determines that a nursing home is not adequately meeting the requirements outlined in the CFR or in the state regulations, they have the authority to issue citations and potentially impose fines on the facility. Subsequently, the nursing home is obligated to take corrective actions to address the identified violations and to ensure future compliance. It is crucial to ensure full comprehension of the applicable regulations to avoid misunderstandings and potential penalties. To effectively navigate the inspection process and maintain compliance, it is advisable to consult the specific CFR sections and state regulations relevant to nursing home operations. Furthermore, proactively implementing robust safety and sanitation protocols alongside comprehensive staff training programs demonstrates a commitment to upholding the required standards. This is important because you must be up to date on interpretations of the code because things can change. It would be best to have a lawyer on retainer for such situations. You would not want to be caught unaware and have to pay large fines. The interpretations that they make have standing in a court of law. A nursing home must meet federal standards in order to continue to be in operation. The Centers for Medicare and Medicaid Services, or CMS, regulate all nursing homes and hospitals in this country. Without meeting those standards, you cannot accept Medicaid or Medicare patients. Most nursing homes and hospitals would close their doors if they were to lose those programs. They are the largest single payer for medical care in this country. Therefore, the federal government has significant leverage over those organizations. States also have the power to set their own standards, but they cannot be lower than the federal standard. States can also add extra requirements on top of the federal ones, but they cannot make it easier to meet those requirements. All these requirements are there to ensure quality patient care. Nursing homes and hospitals are in the business of helping patients recover. Making sure they have a safe place to heal can cut down on secondary infections and improve patients' chance for recovery. This also includes mental health. Patients need a safe mental space to relax, reduce anxiety, and promote mental health recovery. This can include social workers and case managers, psychologists, psychiatrists, and other mental health experts to make sure that the patients have all the things they need to successfully recover from their illness. There are many things that can contribute to a person's mental state. These things can be social, economic, physical, and mental. It can be very complex because no two people are the same. What stresses one person out may not bother another person. Likewise with the physical health of a person. The best way to improve patient outcomes is to address everything that contributes to the health and well-being of that person. It is best to create a plan for each patient and set them up with every resource they need to improve the quality of their life. The more that can be done to improve the life of the patient, the better outcome they are likely to have. A lot of these things require teamwork to be successful. You need to work together with all the experts to get the patient on the path to recovery. All the staff are part of the patient's healing. That includes nurses, doctors, technicians, social workers, mental health experts, therapists, dietitian, and the nursing home staff. This staff provides the day-to-day care that patients need to survive. They also provide a friendly face and are a shoulder to lean on. Nursing homes and hospitals can be a scary place. The staff needs to be empathetic to the needs of the patient to make them feel comfortable and safe. If they feel comfortable and safe, then they are more likely to heal faster and have a better quality of life. The staff has the most amount of contact with the patients and can be the first line of defense against any problems or needs the patient may have. They can relay those needs to the rest of the medical staff. If the patients feel safe and secure, then that is a huge weight off their shoulders. Nursing homes are the place that patients go when they need around-the-clock care that they cannot perform themselves or there is nobody around to provide that care for them. A lot of the patients are elderly and cannot take care of themselves. The staff needs to treat them with dignity and respect. The staff needs to always remember that the patients are people with feelings and emotions. It is important to treat them like human beings and not just a number. The most important thing in a nursing home is patient care. The most valuable asset is the staff. Without the staff, the patients cannot get the care they need. Nursing homes should focus on retaining their employees. They can do this by providing good pay and benefits. They can also do this by creating a positive work environment. They should treat their employees with dignity and respect. This can significantly reduce turnover. The more experienced staff they have, the better the quality of care that can be provided. The nursing home should be investing in the people that are investing in them. This could include sending their staff to continued education classes. They could also provide a bonus structure that rewards good work. The more that you take care of the employees, the more the employees will take care of the patients. It all trickles down from the top. If the upper management treats everyone with respect, then the attitude will go through the entire organization. If the attitude is positive, the employees will be happier and provide better care. They will also want to stay with the company. A positive attitude can go a long way to improving all areas of a nursing home. It will show in the surveys and inspections. A happy and productive work environment is what every nursing home should strive for. It makes everyone want to be there. A nursing home can be a stressful place to work. It is important to have ways for people to relieve that stress. Management should provide some outlets that allows the employees to work together as a team and relieve that stress. This can be anything from a company party to a team-building exercise. They can also just encourage people to take breaks and relax. It can be a very emotionally taxing job. It is important to always check in with your employees to see if they are feeling overwhelmed. Nursing homes are an important part of the healthcare system. They provide a valuable service to the community. They should be treated as such. They need to be adequately funded and staffed. The staff needs to be well trained and compensated. They need to be treated with dignity and respect. The more that we invest in nursing homes, the better the care that the patients will receive. Investing in the patients and the staff is the most important thing that we can do. The more that we do that, the better our nursing homes will be. The AHCA inspectors are part of this process. They need to always remain fair and objective and apply the same standards across the board. The goal of the AHCA inspectors is to improve patient care. They should always keep that in mind when they are doing their job. They should not try to impose their own standards on the nursing homes. They should only be enforcing the standards that are in place. They need to be well trained and have a good understanding of the regulations. They also need to be aware of the changes that are happening in the industry. The more that they know, the better they will be able to do their job. The nursing homes and the AHCA inspectors need to work together to improve patient care. It should not be an adversarial relationship. It should be a relationship of mutual respect. The nursing homes should be open and honest with the AHCA inspectors. The AHCA inspectors should be fair and objective with the nursing homes. The better the relationship, the better the patient care will be. If everyone is working together, then the patients will be the ones who benefit. The staff needs to feel safe to be able to report things that are unsafe for the patients. A nursing home should have no retaliatory policy in place. They should encourage people to report unsafe conditions. If you punish people for reporting unsafe conditions, then people are just not going to do that anymore. This includes management. All levels of management need to be receptive to hearing problems and addressing them. It should not fall on deaf ears. Management needs to take action to correct the problems. The staff will feel empowered to say something. A happy staff is a productive staff. Everyone has to be on the same page when it comes to taking care of the patient. The patients need to come first always. The AHCA inspector may come by and find problems that were not reported. This can lead to fines and penalties. It is better to report these problems and fix them than to have the AHCA inspector find them. Being proactive is better than being reactive. It shows that the nursing home is taking patient care seriously. The culture has to be one where everyone is looking out for each other and the patient. It is a team effort to make sure that everyone is safe and getting the care they need. This starts on the first day someone is employed at the nursing home. They need to be told that they are part of something bigger than themselves. That they are there to take care of people who cannot take care of themselves. It is a noble profession and everyone needs to be proud of what they do. The AHCA inspectors are there to make sure that the nursing homes are doing what they are supposed to be doing. They are there to protect the patients. The AHCA inspectors are not there to be mean or vindictive. They are there to make sure that the patients are getting the care they need. The AHCA inspectors should be treated with respect. They are doing a job that is important. They should be given the information they need to do their job. The nursing home should be open and honest with the AHCA inspectors. The AHCA inspectors should be fair and objective with the nursing homes. The better the relationship, the better the patient care will be. All parties involved should remember to be respectful of the other. A professional, courteous attitude can go a long way to make the inspection process go smoothly. If both sides have this attitude, then they can work together to make the facility better for everyone, including the staff and the patients. It can be a very difficult environment to work in, and that is why it is important for everyone to have a respectful attitude. AHCA inspectors have to follow the rule of law and cannot supersede existing rules. They can only interpret rules. Nursing home management also has the option to argue the AHCA interpretations in court.